I'll just give you a quick COVID update and vaccine situation update. To date, we have 15,373 cases in Navajo County total for COVID, and 6,779 have been worked by our Navajo County public health nurses. We've had 8 new cases in the last 24 hours. Our big news and updates today circulate and surround vaccine. The CDC and FDA released this morning a combined press release regarding the Johnson & Johnson vaccine, the Janssen product. It has been recommended that we discontinue use of that product temporarily, pending some further assessment and investigation. There have been 6 cases, 6 individuals who have developed blood clots after receiving this vaccine. If you look at that in the whole scheme of things, we've had over 7 million doses administered in the United States, and 6 is a minimal number compared to 7 million. However, the CDC and FDA take these vaccines very seriously and are constantly monitoring and assessing that. So pending further investigation, they have advised that we discontinue use of this vaccine temporarily. Tomorrow, the Advisory Committee on Immunization Practices will be meeting to review the situation, the data and information, and then we'll be releasing further guidance. So we have issued guidance to our facility partners in Navajo County this morning to please discontinue use of this product until we know more information. We do want to let people know, I know we'll have concerns for people who've received this product. What you just need to do is for 3 weeks after having received your vaccine, you would just want to monitor yourself for signs of a blood clot. Those could include things like a headache, severe abdominal pain, calf pain, fatigue, or shortness of breath. So for 3 weeks after receiving your vaccine, just be especially tuned in. And if you experience any of those types of symptoms, we suggest that you follow up with your healthcare provider. To date, we have about 36% of the residents of Navajo County who are fully vaccinated with COVID vaccine. We have a few concerns or things on our radar right now. Next week, this week and next week are the weeks that we reach 90 days out from the peak of our last surge of cases, which was in January. And natural immunity after being infected with COVID carries you for 90 days. Once you hit the 90-day mark, your immunity starts to wane or decrease, and it can put you at risk for reinfection with COVID. So we're just trying to plead with our community, especially those who have been vaccinated or have contracted COVID in the past, to please consider being vaccinated. Right now, we contribute a lot of the reason that we're seeing such low incidence of disease to 2 things. The 36% of our population who have already been vaccinated, but also during our last surge, 30% of our overall population was infected with COVID at that time. You couple that with our vaccine coverage rates, and we're above 60% coverage for our community, which is pretty good herd immunity. However, as those individuals who were infected during our last surge start to experience this waning immunity, it can put them and our community at risk for a possible third surge, which we really do not want to see. So we're just pleading with everyone to please consider being vaccinated. If you have current concerns, speak with your healthcare provider, or you can contact local public health and we can try to work through some of those concerns. The blood clot issue is not a concern at this time with the mRNA vaccines, which are the Pfizer and Moderna products, and those are readily available in our community. So we just encourage you to please consider whether or not vaccine is a good option for you. That's our update this week. Thank you.
Thank you, Janelle. Is there any questions that someone may have for her? So, we appreciate all that you and your team are doing to provide safety and the best care that you can for Navajo County and its citizens. Thank you so much. Appreciate it.
Thank you.